Hi, so my name's Rachel. I've sort of recently joined the group. I've just moved here from Auckland, where I was studying clinical exercise physiology. So I've sort of completed all the required training. I just haven't yet sat the full registration exam at the end. So some of you sort of might have a few questions about, well, what is a clinical exercise physiologist? What on earth do you do? So basically what we do is we assess and then we prescribe appropriate exercise for people with a wide range of different health conditions. So usually it'll be things like after a heart attack or a stroke, people with sort of respiratory conditions, COPD, Parkinson's disease or multiple sclerosis. Basically, you name it, we've probably seen it before. And I've probably had about 3 years experience, so both within the university clinic and also a private practice in South Auckland as well. But I also have ME myself, so I've had it for a good 14 years or so. Got quite severely unwell as a teenager after a virus. I've sort of gradually improved, but I'm probably still in the sort of mild to moderate category. I sort of only work or study part-time, and yeah, definitely need my rest every day. So yeah, I thought I'd just sort of provide some ideas, both from a professional and a personal experience sort of perspective. But I did just want to sort of put a quick disclaimer out there before we start that there's not sort of currently enough research to provide really sort of set in stone, evidence as to exactly what you should be doing. So what I present are ideas only, and they won't be suitable for everybody, okay? So you guys know your body's best, and sort of just take what you think you can manage from this, okay?
Is it now?
Yeah. All right, so I'll start off sort of talking about well, what happens to our body when we are confined to bed versus the normal sort of benefits or responses to exercise. But then we'll have a look at the literature and around exercise and ME and sort of what might be going wrong. I'll mention a few different types of exercise that might be sort of beneficial. And briefly describe sort of exercise intensity in relation to terms like your anaerobic threshold. I've got a few sort of general recommendations, how to sort of pace and sort of self-monitor how much activity you're doing, as well as some ideas for different severity levels. Hopefully we'll have time for questions at the end as well. So there's quite a bit of content. If you feel like you're glazing over or you need to sort of, take a break and have a rest, I think that's perfectly fine. It's all being recorded, so you can go through in your own time later on. So basically our bodies are sort of designed to sort of function optimally while we're in the upright position. So when we are confined to bed, unfortunately, we do quickly lose our muscle mass and strength, especially in those muscles that normally counteract gravity. Okay, so that's your neck, your lower back, your trunk and your core muscles, your bottom, thighs, and your calves. And the rate is about sort of 5 to 12% of your strength lost per week. And after about 3 to 5 weeks, almost half of your strength is gone. We also lose bone density, not at the same rate as muscle, but it does increase our risk of fractures, especially in postmenopausal women. But perhaps the most drastic changes occur in the cardiovascular system. So we get a rapid loss of blood volume, which has the potential to worsen orthostatic intolerance. We get a decrease in the amount of blood our heart can eject in one beat, as well as a reduction in the blood flow to the muscles. There's also some muscular changes that happen as well in terms of our ability to sort of generate energy. Contrary to all of that, in healthy people, exercise has a whole host of positive benefits. So it completely counteracts the effects of bed rest. It improves our brain function, our immune system, improves our sleep, reduces anxiety and depression, helps us maintain a healthy weight, reduces our risk of sort of multiple different chronic conditions, and can even help us to live longer. And in pretty much every other chronic condition, but for example, if we talk about cancer, exercise has actually been shown to help reduce fatigue. But we know that in ME, if we sort of do too much, that we get this post-exertional malaise. So we'll have a quick look at the literature and sort of what might be going on, and that should help to inform how we should approach exercise. So common protocols to look at post-exertional malaise have used this sort of 2-day maximal exercise test protocols. So usually it's cycling where the workload gets incrementally harder until the person reaches exhaustion, and then the test is repeated 24 hours later during their crash or post-exertional malaise. So as you'd expect, the ME patients show significant reductions in the amount of work that they can perform on the second day. And it's seen in all patients regardless of their disease severity, but the reduction is greatest in the most severe patients. This study looked at the timeline in terms of post-exertional malaise. So instead of repeating that maximal exercise test 24 hours later, one group of ME patients repeated it 48 hours later, and another group repeated it 72 hours later. And both of those groups were compared to healthy controls. So basically, this study showed that the reduction in workload is greatest 24 hours after maximal exercise. It was minimal at 48 hours, and at 72 hours, the ME patients were actually able to work slightly harder. Okay, so one of the most important findings is probably this table down here. So with the previous study, they found that 2 tests separated by 24 hours. Okay, so the next day, it took patients about 21 days to recover. If the tests were separated by 48 hours, it took them about 11 days to recover. And if the test was separated by 72 hours, it took them only 5.5 days to recover. Okay, so recovery time was basically halved for every day of rest in between the maximal exercise bouts. So that sort of tells us a wee bit more about sort of responses with different frequencies of exercise, and the importance of sort of allowing your body to sort of rest and recover in between. In terms of sort of cardiac function and your nervous system, there's been a lot of studies showing that ME patients might demonstrate a lower maximal heart rate. So that's the highest heart rate you achieve during a maximal exercise test. And the values that have been reported are typically sort of 80 to 90% of where your heart rate should be based on your age. Studies have also shown sort of poor heart rate recovery and blood pressure recovery after exercise, which they've associated with sort of a reduced reactivation of your rest and digest parasympathetic nervous system after exercise. I'll also briefly mention here, some of you might be wondering about, well, what happens with sort of less intense exercise or submaximal exercise? Lynette Hodges has actually done a research study about this, but it's not yet published, so I can't really sort of present the full results. I'm sure she'll tell you about that at some stage. But she has sort of given me the green light to discuss it because it is quite important. So she looked at 5 minutes of exercise at people's individual anaerobic threshold. So that's the threshold between lighter exercise and more intense exercise. Okay, so 5 minutes at that intensity on 2 consecutive days. And basically she found that there was sort of 2 subgroups of ME patients. The majority of patients, 7 out of 11 people, had this sort of excessive heart rate and blood pressure response, okay, and they perceived that the exercise was harder. The other group of patients, which was a much smaller group, they had normal heart rate and blood pressure responses. So it sort of shows us that there are sort of varying responses. Some people may be able to tolerate exercise close to the anaerobic threshold sort of more frequently. But for the majority of individuals, that sort of cardio type, cycling exercise at that intensity isn't appropriate, and it actually produced significant sort of physiological strain on their body. Okay, so that was a really good one. This study is quite important just to show you about the differences between people who are able to complete a 16-week graded exercise therapy program and those who actually withdrew. So the exercise was sort of prescribed 5 times a week. It began at light intensities for about 10 to 15 minutes and sort of gradually increased to sort of more moderate intensity and longer durations. 16 people actually withdrew before they even did the first baseline exercise test. Of those who completed the first baseline tests, 36% dropped out because of significant post-exertional malaise. So they found that those who had sort of a higher sympathetic, sort of that fight-flight response activity, as well as sort of poorer cognitive function and a lower maximal heart rate, they were much less likely to be able to complete the exercise program. So that sort of gives us a few ideas in terms of things we might be able to sort of monitor and look at to work out whether we're doing too much exercise. Okay, so I'll quickly go through these ones as well. This study has looked at blood vessel function and whether it worsens with post-exertional malaise. So they did a maximal exercise test and then they repeated measures of blood vessel function at 48 hours or 72 hours after the exercise. And what they found is that at 48 hours, ME patients didn't show the normal sort of relaxation and dilation of the large artery that comes out of the heart that the healthy controls showed. Okay, so there's some sort of abnormality there in the sort of normal relaxation and dilation of blood vessels. And there has been a lot of other studies since then that have shown abnormalities with blood vessel function. These ones aren't specifically related to exercise, but yeah, there's definitely accumulating evidence of that. Really quickly, I'll talk about muscle function. It's very complex, and I won't go into it in great detail, but there is evidence of mitochondrial dysfunction. So your mitochondria are your sort of energy generating powerhouses of your cells. Okay, so some suggest that the problems are due to this sort of excess oxidative stress, which is worsened with exercise and ME. Some have sort of really hypothesized that maybe it's due to abnormal blood flow to the muscles, which might be just due to autonomic nervous system dysfunction. This study here is actually also a really good one in that it showed that some patients with ME have a delay in recovery of muscle pH, so the sort of acidosis, after low level sort of strengthening type exercise of the calf muscle. And they suggest that maybe that contributes slightly to the muscle fatigue that we experience as well. So from that one, we can kind of take that we may need longer recovery periods after bouts of sort of muscular effort compared to healthy people. I'll quickly mention this one as well because people often ask about lactate. So lactate is a byproduct of more intense exercise. So once it starts to sort of build up and accumulate, it's often associated with that burning kind of sore muscle sensation and, you know, hitting the wall 3/4 of the way around a running race. So they did a 24-hour repeat maximal exercise test. They found that on the second day, the ME patients achieved a lower workload, but they had the same level of lactate accumulating in their system. So they weren't able to sort of clear that substance as well as healthy people or as they were on the first day. And they're not sure exactly why that happens, but it could be to do with the actual energy pathways that are used. Okay, so that was a lot of information. So just to sort of briefly summarize, exercise capacity or peak workload is the most impaired 24 hours after maximal exercise, and it's seen in all ME patients. We often have a lower maximal heart rate, so we can't really use heart rate for prescription purposes. We also show a really poor heart rate and blood pressure recovery after exercise, so it is important to make sure that you're resting after you do any movement. 5 minutes of more moderate intensity exercise on consecutive days is likely to be sort of inappropriate for most people. That was a very small study though, so it does need to be replicated. High sympathetic nervous system activity might suggest impaired capacity for exercise. We do show abnormalities in the dilation of blood vessels. We may need longer recovery periods between bouts of exertion. And there are findings of sort of problems at the muscle level in terms of the mitochondria and the energy pathways. Okay. So then we move on to, well, what type of movement or sort of exercise might be appropriate. And I think for most of you, it's not going to look like this or this. It's probably going to be more like this, which is, you know, completely fine. But basically, there are 3 main types of exercise that are generally recommended as part of a comprehensive exercise program. So your sort of aerobic or cardio exercise. So that's like your walking or, you know, gentle cycling or swimming. That might help to sort of boost your blood volume, improve your sleep. Theoretically, it could improve your autonomic nervous system function. So, you know, improving the rest and digest side of things and suppressing the fight or flight response. It should also sort of improve brain function a wee bit and muscle function. There is some evidence in sort of the graded exercise studies showing improvements in autonomic nervous system and cognitive function. But there was a very high dropout in those studies, okay? So it's possible that those beneficial effects are only seen if the exercise is manageable and sort of within your energy envelope. Okay, so strengthening exercise is actually also really important. So it helps to keep our muscles and our bones strong. And more importantly, it makes our daily activities a lot easier. And also strengthening, okay, so that can help to sort of lengthen tight muscles from inactivity, but it may also help reduce some of the pain that we experience. So the connective tissue surrounding muscles has a lot of pain receptors, and it can get quite tight and knotted with inactivity. So by stretching and sort of lengthening out that tissue, it can help reduce some of that discomfort. And I've just put a little note in there that if you've been diagnosed with the hypermobile form of EDS, stretching isn't suitable. Okay, so thought I'd quickly talk about exercise intensity. So this graph shows breathing rate along the y-axis and exercise intensity along the x-axis. And this first line here, that indicates your anaerobic threshold. So the threshold between light intensity and more intense exercise. So this kind of value and where it sits in relation to your exercise intensity, it's different in everybody, and it is influenced by exercise training. So if you're more fit, your anaerobic threshold's likely to be a wee bit higher. But generally it sits sort of about 50% of your maximal exercise capacity. Once you go beyond your anaerobic threshold, your breathing rate starts to increase, and it increases even more steeply once you reach this sort of compensation point, which marks, very vigorous or near maximal exercise. So we want to always make sure that we stay in this sort of green area, okay, and we don't feel puffed at all. So some general recommendations if you feel that you can do some form of structured activity or movement. It's sort of common sense type things, but choosing a time when you feel like you've got the most energy, making sure you've had enough to drink and you're not too dizzy before you start, and you've had something to eat. Okay, so don't try and do some movement on an empty stomach. Also, if you've got, if you really sort of struggle with the orthostatic intolerance, or if you've got POTS, I would suggest beginning with supine or exercise lying down, okay, and avoid any rapid changes in posture. Always start out cautiously and don't exercise every day, okay, so 5 to 10 minutes every 3 to 4 days is probably enough to begin with, and you can always increase it further down the track if you feel you can do more. It can also be split up into shorter intervals, sort of interspersed throughout the day with recovery periods afterwards. So make sure you rest for around 15 minutes after any movement to allow your body to sort of recover and your heart rate to come back to normal. You can also rest beforehand to sort of prepare for the movement and make sure you're not too tired to begin with. And remember, some of that research suggested that exercise at the anaerobic threshold might not be appropriate. So at this stage, I'd recommend keeping the exercise intensity very light. There's a couple of ways that you can check that you're not pushing beyond your anaerobic threshold. You should never exercise to a point where you feel puffed or sweaty. And you should be able to hold a conversation and sing throughout the entire time that you're moving. Okay, so you don't have to burst out a melody, but just checking in, under your breath. Can I sing a song at the moment? I can't give heart rate ranges because people do have very wide-ranging sort of responses to exercise, as Lynette's seen in her research. Ideally, your individual response needs to be measured directly, like through a maximal exercise test, but that does come with risks. Okay, so in terms of relapse and sort of prolonged recovery. I was talking with Lynette Hodges, and she's mentioned that she would be happy to sort of come down at some stage and help me with some testing. I know that they do have facilities at Otago Uni. So yeah, if anyone's interested, you're welcome to ask me a wee bit more about that. This is probably the most important thing when you're trying to sort of incorporate some new activities or movement into your day, is sort of pacing and being able to sort of understand how much you can do. So there's different ways of monitoring this, but the idea is to work out sort of what you can consistently manage without setting off post-exertional malaise. So the first method is using a diary to sort of document all your daily activities that require energy, any sort of structured movement or physical activity, and generally sort of how you're feeling afterwards. So remember that post-exertional malaise can even take a couple of days to show up. So jotting it all down can sort of help you keep track of what you can consistently manage. So for example, you know, if you've caught up with friends on one day, you know, it might be too much to go for a walk or something like that. You know, you might want to take the lift instead of the stairs if you've, you know, driven a long way, or, you know, done something else like, you know, making meals or, you know, housework and things like that. When you add any additional movement, you may need to sort of drop any unnecessary tasks, so you don't sort of overexert yourself and push beyond what you can manage, okay? So that's where it becomes quite important to sort of note everything down. And it's all about sort of priorities and you know, managing your energy limitations. You can also use a step counter or pedometer alongside a journal. But just be mindful that they're not always accurate. They're not going to pick up everything that you're doing. So, you know, sitting, folding the washing or making dinner, they still require energy, but the pedometer or the step counter is not going to pick that up, okay? And especially if you're using a smartphone, you always need to take that with you, so it won't pick up everything. Some people like to sort of monitor their heart rate. So they come to sort of understand what heart rates are okay within the energy envelope and what's going to push them into post-exertional malaise. There are some general recommendations out there, but they may not sort of take into account that lower maximal heart rate that has been demonstrated in the literature in the ME. So for some people, these will likely be completely fine to use. For others, they may slightly sort of overestimate your limit, okay? So if you want to really err on the side of caution, you can always sort of reduce these by, you know, 5 or 10, even 10%, and just sort of see how you go, okay? You can always sort of increase it, you know, a month or so down the track if you're doing well. Another good idea would be sort of monitoring your heart rate and your blood pressure if you've got a automatic cuff at home while you're doing your normal everyday activities, and then correlate that with sort of how you're feeling in a journal or a diary. So if your heart rate or blood pressure goes too high and you feel really wiped out in the days afterwards, you know that that level of exertion is too much, okay? And just keep in mind with this, if you are monitoring heart rate, that heart rate is affected by, you know, your hydration, your posture, temperature, if you've had any caffeine or alcohol, emotions is a big one, medications, and any physical activity. Okay, so for example, these heart rate recommendations won't be appropriate if you're taking beta blockers, because your heart rate will be lower than normal. Okay, so it would really overestimate your limit. Okay, so if you are taking beta blockers, make sure you lower it quite a lot and see how you go. The next thing to sort of look at, once you've established what you can comfortably manage in your energy envelope, is to know when to adjust your activity levels based on your physiological responses and sort of how you're feeling. So heart rate's probably the most sensitive measure. So you can measure your heart rate at the same time every day in a sort of relaxed state. So before you have your morning coffee, on any given day, if it's sort of higher than your normal value, say by more than sort of 10 or 20 beats per minute, it's a good idea to sort of reduce how much activity you're doing or rest. But also sort of think about the situation as well, and you know, whether your heart rate's high because you did just have a coffee, or you might not have had enough to drink, you might be too hot. If it's posture related, so if you've just sat up and your heart rate's really high in a seated or a standing position, you may be able to do movement lying down, but not in an upright position. Okay, so it's all trial and error. Really think about the situation when you are using heart rate. You can also use heart rate variability, which I'll sort of explain in more detail shortly. If this is lower than normal, you want to reduce your activity levels. If it's higher than normal, you might possibly be able to do slightly more, like in terms of 1 or 2 more minutes, but I would be very careful not to sort of fall in the trap of overdoing it. And so how to measure your heart rate? There's lots of different devices out there these days that'll do it for you. Usually your sort of Apple or Garmin watches are really accurate, but they'll all give you sort of a general idea. You don't have to have a fancy device. You can sort of measure your heart rate manually by palpating your carotid artery. So that's sort of just next to your windpipe here, and just using your fingers. Sometimes it's best if you sort of look up a wee bit. It's a bit easier to find. If you don't have a lot of time, you can just count the number of beats in 15 seconds and then multiply it by 4. But usually what's more accurate is to count the number of beats in 1 minute, especially if your heart rate's a wee bit irregular. Heart rate variability, you can usually use your activity trackers, Apple Watches, that sort of thing. They should do it for you. But you can also use it in conjunction with other apps. So I think last month, I think it was John last week, I think that talked about this app Elarm, which is really good and sort of gives you a few more metrics and tracks your heart rate variability. I found this app just using a smartphone, okay, so no device, and it just uses the camera and the torch function on your phone to measure through your finger. I would sort of question its accuracy, but it gives you a sort of very general idea. So when you're using heart rate variability, what it reflects is your autonomic nervous system control of your heart rate. So the value that you should use is either this RMSSD, or if it gives you more detailed metrics, the sort of high frequency power component. Because what that represents is your rest and digest, your parasympathetic nervous system. Okay, so that's sort of said to represent a person's capacity for exercise. So if it's lower than normal, you want to sort of reduce what you're doing and rest. And if it's higher, theoretically, you have a greater capacity for movement. Sometimes they only give you this SDNN, which is okay, but it's probably not the best metric to use. And I think another quick point, just while we're talking about this, is that heart rate variability isn't really going to be valid if you've got a condition like atrial fibrillation, okay, because your heart rate's going to be varying a lot anyway, okay. So I would use both of those measures, especially your heart rate variability, if you're going to use that, in conjunction with, symptoms and generally how you're feeling, okay? So really tune into how you're feeling on a particular day. Things to watch out for in terms of, when you might need to reduce your activity is sympathetic nervous system activity. So feeling a bit jittery or, shivering, slightly nauseous. I think probably the biggest one is, if you feel like you've got more energy than you'd expect. So I'm always slightly suspicious if I've had a terrible sleep and I feel okay. Usually that's just adrenaline and I need to reduce my activity levels, even though I feel fine. Another probably big one that I notice in myself is verbal diarrhea. So just talking too much, it's just a sign that I need to just stop, calm my system down and rest rather than, going to try and do too much exercise. And then there's the more obvious signs of post-exertional malaise. Okay, so feeling more tired than usual, if you're more uncoordinated, that's always a sign. If you're struggling with your cognitive function and making decisions, and definitely any increased pain, headaches, dizziness, or sensory overload, they're all signs that you should stop and rest rather than trying to go and exercise. So I've put together a few activity ideas. So just keep in mind that they are ideas only, okay? So they're not going to be suitable for everybody. So for those with mild ME, walking is usually suitable if you can tolerate upright exercise. Gentle cycling is okay, as long as you keep the resistance really light. And I've just put in here that people with POTS or orthostatic intolerance might be better using a recumbent cycle. There's also some evidence that aquatic exercise might be helpful, especially if it's self-paced and at a light intensity. The water's got several effects on your cardiovascular system. It may help to build up a little bit of strength in a gentle way, especially if you struggle with your joints. And it may help to reduce pain slightly. But just be careful not to exercise in hot water due to increased dizziness. Okay, so people with mild ME might also be able to do some form of strengthening exercise. If you're going to do some cardio or walking as well, make sure that you only do, one of each per week, okay, separated by a few days of rest. Try not to do it all in one go. If you enjoy the gym, you may be able to tolerate, a very few light exercises, okay, and usually seated exercises are better to begin with. So yeah, just be careful if you are going to go to the gym not to get too carried away, okay? So things like your leg press, leg curl, chest press and seated row would generally be good places to start. And starting with about one set of about 10 to 15 reps and gradually building up to 2 sets separated by rest if you're managing well. But you can also do exercises at home, okay? So this is sort of an example. So a basic exercise like sitting to standing, we call it sit to stands, or you can progress to a squat type movement. But I wouldn't do that one if you do really struggle with orthostatic intolerance. Okay, so I've given an alternative here. So if you have a resistance band, this is a good one to do. If you don't, but you want one, you can pick them up really cheap at Kmart. I'd always start with probably a light strength one, and then you can always progress to like a more medium strength. Another one is this one here, which is called a Muncie's quad lift. So sitting with your back supported against a wall, one leg bent in with foot flat on the ground and the other leg extended out in front of you. And then you want to keep the leg straight, push the knee down and engage your quadricep muscle at the top of your thigh, and then you lift the leg up off the ground. So the idea is to just lift it and try and hold it for a couple of seconds. It's actually a lot more challenging than it looks, so that's always a good one to try. Another one would be either a wall push-up or a band pull-apart. So I wouldn't do all of these at once, maybe choose one of these and alternate between weeks if you're going to do both. Your wall push-up is going to strengthen the front of your chest and your arms, and you can adjust the sort of difficulty, make it easier by standing closer to the wall and harder by moving your feet away from the wall. Your band pull-apart's a really good sort of postural exercise, so it helps to sort of bring your shoulders back and strengthen your upper back. So it's just sort of pulling apart a resistance band. And yeah, definitely start with a light band for that one. And the last one is just a leg lower exercise for your core. So bending both knees in towards the chest at about sort of a comfortable 90-degree angle. And then what you do is you're engaging your stomach, and as you breathe out, lowering one leg towards the ground. Okay, so you can also adjust the difficulty of this one. If it's a little bit too hard, extending the leg more towards the ceiling. Okay. Probably the most important thing when you're doing these types of exercises is really making sure you're resting as much as you need to. So remember that we may need more rest between bouts of muscular effort than healthy people. And you should never push to the point where you can't complete another rep. Okay, so always leave something in the tank. Some alternatives, if you enjoy yoga or Pilates, they can be quite good to do. If you've got sort of more moderate ME or you really struggle with that orthostatic intolerance, start with your lying down exercises. So Pilates is quite good. And you can do, one exercise, have a rest, and then pick back up when you're ready, okay? There's lots of videos online. You can kind of pause and rest as you need to with those as well. If you prefer yoga and you're okay standing up, make sure that you're sort of holding those standing poses for a couple of minutes to build up that strength. If you've got more moderate ME and you feel like you could manage some aerobic exercise, I'd recommend starting with a stationary bike with basically no resistance at all on the pedal, and just trying a couple of minutes at a time, interspersed with rest. But usually basic strengthening exercises might be more manageable, and they'll help out with your everyday activities. So these are some ideas. Again, don't do these all at once. You could choose a couple to try at a time. So this one here is a really good one, sitting all the way back against the back of your chair, and then just extending your leg out. And you want to squeeze your quadricep muscle and just try and hold it for a few seconds. And then obviously you do the other leg. Okay, so with these ones, I'd probably just try, one set of maybe 6 to 10 repetitions, depending on how you're feeling. And probably don't do any more than, 3 exercises at a time. This one here is quite good just for basic functional exercises like hanging out your washing. So you're just sitting and lifting your arm up to a horizontal level. Okay, so you can just do it with body weight. I'll just check, hopefully you guys can see what I'm doing. Yeah, so just lifting out in front of you. You can do it with body weight, but if you're finding that that's too easy, you can always use things like food cans or drink bottles, where you can kind of tip the water out to the amount of weight that you need. Another one is this one here. So I'll show you this one as well. This is another good postural exercise that just sort of helps to open you up a wee bit. So you just sit up in a chair. You want to pop your arms up into sort of a Y position. And then from there, you just bring your hands backwards and try and squeeze between your shoulder blades. And then you move to a W position. So your elbows come down, and then you're basically trying to move your elbows and forearms backwards, squeeze between your shoulder blades. And then the last one is a T. So straight out to the side, move your hands back and try to squeeze between your shoulder blades. Okay. And you can also do that one lying down if you want to make it a wee bit more challenging, but I'd say that's probably enough. Next one, just for the back of the legs and the bottom muscles, is your glute bridge. So bending your legs in with your feet flat on the ground, about hip width apart. And basically what you do is you push through your heels, push your hips up towards the ceiling, and then you slowly lower back down. And the last one is clamshell. So this one's for the outside of the hips, quite a good stabilizing one. So it's just lying down with your knees bent, and you want your feet, your hips and your shoulders all in one line. Keeping your feet together, you just lift the top knee up. But you just want to make sure that you're not sort of rocking your top hip back as you do so. All right, okay, so for sort of more severe ME or times of bed rest, when we're not moving the joints through their full range of motion, the muscles may sort of shorten and become tight, leading to imbalances across the joint and suboptimal sort of range of movement. So these stretches sort of might be applicable to anyone confined to bed rest. They can be done passively, so with the assistance of a carer or someone like that, or actively by the individual, as long as it doesn't exceed your energy envelope. Okay. Again, so don't do these all at once. Try a maximum of about 2 per week, and you can always adjust as you need to. Okay, so and you want to hold them for about 10 to 20 seconds, preferably about 20 seconds to get the most benefit. So the first one is stretching your calf muscle. So if you're going to do it on your own, it does require a wee bit more exertion, but you can wrap a towel around the ball of your foot, and then you're just gently pulling that towards you so that your toe comes back towards your body. And then this is an example of how a carer can assist you to stretch that same muscle group. The next one, bringing your knee in towards your chest. So either on your own or with some assistance. I've just popped in here as well that if you feel you get quite tight through the glute muscle, you can also sort of bring it across your body. Okay, so bring your knee across your body just to stretch out through the side of your glute. The next one is sort of for your shoulders. So you can do it on your own, either one arm at a time or both arms together, or fully supported with a carer. Same thing with the elbows, so moving the joint through its full range of motion. And these ones are quite good for sort of opening up through the back, and they can also help to sort of reduce pressure injuries. So carers and things like that can support people into these poses and let them stretch out for a few minutes and then help them back again. Okay, so the first one is lying on your side with your feet bent and basically just opening right up to the side, twisting over to the side. And then if you did also want to stretch out your chest muscle at the same time, you'd basically just pop your arm up on a diagonal, okay? And again, that can be supported by a carer, okay, supporting the arm. I've put just a couple of extra stretches. This is just from personal experience. I know sometimes if I'm in bed for a long time, I get quite tight through the forearm, so that wrist stretch is quite a good one. Also through the neck and shoulders. Okay, so there's one turning straight over to the side, which gets along the side of your neck, and one towards the back of the neck as well. These ones I would sort of save for good days, or if you're sort of just in a bit of a temporary setback. Okay, it helps to sort of minimize muscle loss. So breathing out during these contractions is really important, because if you hold your breath, your blood pressure is going to go up. Okay, so you want to try and contract and hold the muscle for a few seconds and then relax and rest, okay, and then repeat as you're able. Oops. Okay, So this one is probably quite an important one, pushing your knee down towards the bed and really contracting your quadricep muscle up the top of the thigh, and just trying to hold for a couple of seconds and then relaxing. This one is slightly more difficult, okay, so only do it if you feel you can manage bending your knee up and then just pushing your heel down into the bed slightly, okay, so it's going to work the back of the thigh here. This one is another one, so number 1 and 3, I'd say probably some of the most important ones. So pushing your toes down, so like you're really planting your foot on an accelerator, and holding for a few seconds, squeezing the calf muscle. Wow. Same thing, so squeezing your bottom muscles together. And this one's a wee bit complicated. So basically you're bending your knees up with your feet flat on the bed, and you want to try and tilt your pelvis and flatten your back down towards the bed while you engage your tummy muscles, okay? You've also got to remember to breathe out, okay? So you're lowering your lower back towards the bed, tightening your tummy, and if you're feeling really good, you can also pop a pillow between your legs and squeeze between your legs at the same time, okay? But I would mainly focus on this component of it. I've also put an extra one in there just in case you did want a next, another exercise to add to your toolkit. This one is just sliding, so keeping your legs straight, sliding away from the midline of your body.
Oh, right.
So just like in summary, so people with ME do have an abnormal physiological response to exercise, and there's quite likely different sort of subgroups. So some people respond more normally and others have quite an adverse response. My sort of general ethos is that some activity is better than nothing, and it's likely to have beneficial effects if it doesn't exceed your energy envelope. Keep the intensity light, okay? So you should be able to talk and sing while you're doing your movement, and you may need to sort of adjust your mindset slightly, okay? So this is just movement for your health and well-being rather than exercise to, improve your fitness or build muscle or improve your body composition. So you can use the diary or a journal, step counter if you want to, heart rate or blood pressure to sort of establish what you can manage within your energy envelope, and then using your resting heart rate or your heart rate variability as well as symptoms to determine whether you need to sort of adjust how much exercise you're doing on a certain day. Don't do everything at once, okay? So spread everything out. Make sure you're resting for a couple of days in between each bout of activity. And if you think you can manage both your aerobic or cardio and your strength, only doing one of each per week to start with. Always leave some energy in the tank. Stop before you reach your limit. And you guys are the best judge, okay? So always listen to your body. All right. Any questions? I noticed that there are a few things in the chat. Yeah, singing. It's an interesting one. Yeah, I think the whole idea, so it's all related to sort of how puffed you're getting, I guess. Yeah.
I'd always heard, make sure you should never exercise beyond a point where you can have a conversation.
Yes.
Like if you're going beyond that, you're pushing too hard. Even for a healthy person, you should still be able to have a conversation. Yes. And I thought, well, if I can sing, that's taking a little bit back from conversation, because I can still talk even when I'm quite puffed.
Yes, exactly. Yeah, that's the thing. Yeah, because often, that's a general recommendation to most people, is that they should be able to maintain a conversation but not sing, but for us, we should definitely be able to sing as well, because otherwise you're sort of more into that moderate intensity, so that's sort of around your anaerobic threshold. Yeah, because I
also found singing helped me hold a plank longer.
Ah, wow. Yeah.
I think because it distracted me.
Yes, yeah, possibly as well. Yeah.
And it reminds you to breathe.
Yes, yes.
Yes.
Does anyone else have any other questions? I know that was kind of quite a lot, and you know, a lot to take in. Anything that anyone's wondering about, or
Jill has said, I'm so grateful for the severe ME CFS strengthening exercises. I've started to notice a real loss in strength and couldn't find a starting point online for where I'm at. Bed exercises were more in line with healthy people who run well.
right? Yeah,
Okay.
yeah.
Mm.
Yeah, so see how you go with those. I'd really start off, you know, easy, and you might need to, you know, only do a couple of contractions of you know, 1 or 2 of those exercises. Definitely don't go through the whole list all at once, because I'd say that that's going to be too much. But yeah, sort of see how you go. You guys will know, you know, generally how much you might be able to manage. But yeah, it's always a good idea to try and do a little bit of that if you are stuck in bed, and if you can.
I don't know if it's an ME thing or a me thing. It might just be weird genetics. But I notice I don't decondition at the same rate that people say you decondition it.
Right. That's
Like it's been 4 years since I've been able to go to the gym at all, and I'm only now really in the last 6 months noticing that I've had a significant muscle loss.
right.
And
wow.
my fitness even like I could take a year off the gym and go back and still squat where I still squat the same weight that I left off with, and
Oh gosh,
my fitness doesn't drop. So
that's
and Jill says
fantastic.
that she's also noticed 6 years to notice the muscle loss. So I don't know if it's that we're just on a real go slow.
Yeah,
We're on a different
isn't that interesting?
scale or what? But yeah, it's only like in 3 years after stopping exercise that I'm really noticing a change in my fitness levels and a change in my strength.
Yes, that's very interesting actually, and I think
It's dropped quickly.
Yeah, possibly if I look back, I might have been like that too, but I can't quite remember. It's been too long. But yeah, no, that's a very interesting point, and I think that'd be an interesting sort of subject to look at with further research. Because generally it does sort of decline very quickly. Yeah, that's an interesting one. Yeah, I haven't thought of that before.
Because our bodies are in they're in a state of hibernation effectively, aren't they? So maybe there's something going on in one of those muscle changes that
sort of
puts it all on hold.
Yes, and that may also sort of be related a little bit to the energy pathways. So we're possibly not using our amino acids or proteins. We're not breaking down our muscles for energy. So that's a good thing. And I think Nicola's mentioned also, yes, you do lose muscle as you age as well. So especially sort of after the age of 50, but it does actually start in your after 25. So sort of once you're in your 30s, it's a bit of a downhill slope, but it's a lot more steep, the loss after 50. So yeah, it's even more important to try and maintain a little bit of muscle strength if we're a wee bit older, to try and maintain as much independence as we can, I guess, as we age.
I have a friend in the UK who's a yoga instructor, and she does online yoga lessons. Her brother has severe ME, was locked in a room with noise cancelling headphones and curtains for 12 years. Kind of level of severe.
Right.
And I have a feeling she's done at least one class that was targeted to us, knowing that it would be safe for him.
Right.
I'll have to get in touch with her and ask if she has, and if she hasn't, then I'll get her to do one.
Yeah. Oh, that would be fantastic.
She'd be really keen, and we could share around.
Yeah. Oh, absolutely.
Just when you were talking about yoga, I was like, oh shit, I should see if Joy's done one.
All right, so John's asked about how to determine your heart rate for anaerobic threshold. So I might even see if I can go back to, oh, this is going to take ages. We'll go back to this slide here. So this one's sort of generally trying to sort of look at the sort of heart rates are close to your anaerobic threshold. So for most people, your anaerobic threshold is going to be around, I would say probably 65 to probably about, 65 to 75% of your maximal heart rate. So given that our heart rate is a little bit lower, often our maximal heart rate, that's kind of where you need to be a wee bit careful in terms of using your heart rates to work out where your anaerobic threshold is. But that's where this kind of calculation is sort of trying to set a limit that's close to your anaerobic threshold to keep you below that. So for mild ME, it's doing the 220 minus age and then timesing by 0.6. So 60% of your maximal heart rate is probably sitting at about just over 40% of your maximal exercise capacity, and usually your anaerobic threshold is at 50%. So there is a little bit of wiggle room there. So for most people, this might be okay, but it's possible that I'm probably going into too much detail here, but with your anaerobic threshold, if you're deconditioned, it's going to be lower. So it can be, so in mitochondrial diseases and things like that, it's usually at about 50% of your maximal exercise capacity. 40% of maximal exercise capacity. So it all depends on where your individual anaerobic threshold is, and we can't determine that unless we measure it. So with a cardiopulmonary exercise test, and that's where you have the sort of mask on and they measure the gases and things like that. So I can't tell you exactly where your individual threshold is, but usually it's between, I'll say we're feeling normal, because looking at the literature, our anaerobic threshold is fairly normal. So I'll say it's sort of between about 50 to, or 45 to 60% of your maximal exercise capacity. And that correlates to about sort of 60 to 70% of your maximal heart rate. I know that's probably too much detail, but
in that graph though, that where you had the breathing, the threshold, the anaerobic threshold and the threshold zone and endurance, that thing. When you're saying it's better that we should be monitoring our breathing rather than our heart rate because it's a better indicator?
I would say yes. So because we don't know, heart rate's really difficult for me to sort of say, because if you remember, I sort of briefly mentioned Lynette's study. So she found that some people had really, really high heart rate responses, and some people had normal responses. And so that was the same level of individual exercise intensity. So it was at the anaerobic threshold. So it was individually calculated. It should have all been the same, but people have really varying responses. So I would say the general tools of using your breathing rate and, you know, making sure that you can maintain a conversation and sing, that may be slightly more useful, but it is quite broad, and that yeah, it's quite a broad measure. So you could use both, but yeah, there's not really any, I can't really give you a heart rate to say, look, you must stay below this, because everybody's different. So yeah, I would say, yeah, definitely make sure that you can kind of maintain a conversation and sing. If you want to use heart rate, you can, and you can use those sorts of calculations. You know, given that you have, assuming you have a normal response, I guess, a normal heart rate response, these should be okay. So you could use both. You can use blood pressure as well, because that's another, you know, another measure, but you do have to have a monitor to be able to do that. I, like, personally, I didn't actually monitor any of this because none of this information was available. So I actually just used a diary. I just tracked what I was doing, how much I could do. I worked out exactly how much, you know, exercise I could manage consistently, and I stuck to that. So, you know, you don't have to, some people get overwhelmed with monitoring everything. You don't have to, you know, monitor all the numbers and get really fixated on them. You can just use like a you know, common sense approach and just see how you go. Does that sort of answer that?
Yeah, yep. Thank you, Rachel. Thank you very much.
Knowing your own numbers is probably more useful than having something out of a textbook anyway. Yes. Like looking at that blood pressure thing, saying keep your blood pressure below 220. I'm like, if my blood pressure got to 220, I would probably be dead.
Yeah. Hopefully not. Hopefully not.
When I'm exercising, like really full on doing something like digging in the garden or something that's quite stressful to my body, that will leave me in bed for a week, my blood pressure would get to 160.
Right.
Because like over 110 or something like that.
Yeah.
Because I'm usually really low.
Right.
So
yes.
like I know what's high for me.
Yeah.
It's certainly not what a doctor would consider to be high blood pressure, but it's high for me.
Yeah, exactly. And blood pressure does go up with exercise, so that would probably be a fairly normal response. But yeah, if it's getting up sort of near 200 when you're just doing everyday activities, that would be the people that, you know, Lynette's sort of seen with these really, really excessive blood pressure responses. So she actually had a couple of patients where they were doing their 5 minutes of exercise and she had to actually stop them because their blood pressure got so high, and it was more of a safety thing. So their blood pressure was getting to sort of 240, 250 millimeters of mercury. So yeah, that's another measure, and you're right in that the best way of going about it and making sure that you are safe when you're exercising is to have all those measures taken. So that you know what your individual response is like. And then we can sort of give you sort of more tailored advice in terms of where you should be exercising and heart rates you should aim for. So that's where those cardiopulmonary exercise tests sort of come in handy. But yeah, as I mentioned, you know, you've got to take into account, you know, the potential for relapse and you know 21 days, you know, recovery, or no, sorry, probably wasn't quite that much if you're not going to do a second test, but some people do still take that long after one test. So yeah, you've got to take that into consideration as well. But yeah.
So where do you get one of those tests?
Good question. So I'm sort of trained to do those tests, but I don't have, I'm working in a different field at the moment at the hospital. I don't have any equipment. It's very, very expensive. But I know that they do have a testing bike and everything at I think it's at the Otago Uni, which must be, you guys probably know better than me, it must be in Christchurch somewhere. They've got an exercise science department. So yeah, that was something that Lynette mentioned, that she might be able to come down and use their resources, and generally it's
so you don't have to go to you don't have to go to Otago then.
You would have to go to Otago for that test.
Oh, you would. Oh, okay.
Yeah.
I think Lincoln University have one as well.
Oh, they do?
Oh.
Okay.
I think they do. I was looking at trying to get the test done, and I think there was one out there.
Ah, interesting. Cool. Okay. I know that they do. Yeah, they do sport and rec there, don't they? So
yeah,
it's just whether they have that. It's a very specialised metabolic cart that we need to do the test. Cool.
Yeah.
Can look into that as well.
Sorry, Rachel, this is the CPET test we're talking about, is it?
Yes. Yep.
Cardiopulmonary exercise test. Yes. Okay.
That's it. Yeah. Yep.
Wonderful.
So any more questions before we wrap this up?
And I think Joe's just also put in there that she often does yoga exercise sitting in a chair, which works well, that's a good idea as well. Any supported movements, you can find some that are supported with pillows and things like that.
I must say, Rachel, you've got particularly good presence of mind. Your ME doesn't impact too much on brain fog for you then.
Oh, it really does. I'm probably just hiding it a while, but yeah, I didn't sleep very well. So I am quite fogged today.
Well, Rachel, this has been an exceptional session for us. You know, you've covered so much, you know, summarised the research, but, you know, also given us some really clear guidance about gently finding what might be useful for us. And yeah, we're just really appreciative. And you're also sharing your slides with us. So a couple of people have asked me if we'll be able to, you know, share screenshots or as well as the video. And yes, we will. So we, you know, if you want to, we might put it in a handout, something, these exercise suggestions. I think that would be helpful for people. So yeah, thanks so much for your preparation time and your time here today, Rachel. And